For instance, if we find this gene, I'm glad Dr. Newman just talked about oxytocin. Here's a gene that's one of our patients found out was positive. Certainly, they actually respond to KCC2, which is a more kind of a chloride channel that interferes with oxytocin. Everybody know, I think we have this exciting, excitatory, and speech, dopamine and GABA. Actually, the oxytocin is responsible for their early transition from the excitatory GABA to the inhibitory GABA. I think if you find that, you sort of get a clue. You know this kind of patient, if you use the oxytocin, that will work. Because there's clinical trial indicated. And I did a clinical trial for oxytocin too. Not everybody working. Not everybody responding. So why? Certainly there are some receptor issue. There are some just, all kind of different factors impacting this pathway. But if we know this gene, kind of have variance, you sort of get a clue, try to cut in some kind of common pathway. That's how we kind of use the, that kind of system, try to narrow down and to, get at least a more kind of targeted, somewhat targeted, not really targeted therapy.